Good evening, and welcome to New York City Health and Hospitals Fiscal Year 2024 Annual Public Meeting for the Borough of Brooklyn. Before we start the formal program, I would like to call to your attention that we have language translation services available in Spanish and French Creole. If you require these services, please call 212-788-3359. Again, 212-788-3359. Thank you. My name is Dr. Patricia Marthone, Brooklyn City Council, Brooklyn representative to the Board of Directors. I want to thank you for joining us and would like to introduce our other board members who are participating. Dr. Jose Pagan, Board Chair. Jackie Rowe Adams. Karen Saint-Hilaire, I'm sorry, she's not here. Karen Saint-Hilaire, who's also representing, she's parking. She's representing Molly Wasser Park. And Dr. Mitchell Katz, President and CEO. Also on the panel are Blanche Greenfield, Deputy General Counsel and moderator for this evening, and Colicia Hercules, Secretary to the corporation. I would like to recognize Sydney Renwick, Chief of Staff, representing Office of the Assembly Member Brian A. Cunningham, 43rd Assembly District, and Blake Shaw, Budget Director, representing the Office of the New York City Council Member Farah N. Lewis from the 45th District, all in listening capacity. On behalf of the board, I would like to extend our thanks and acknowledge leadership at our Brooklyn facilities. Gregory Calise from Woodhall, Sheldon McLeod, Kings County, Svetlana Limpinskaya for South Brooklyn Health, and David Weinstein for Susan Smith McKinney, and their dedication and their dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care for all. Now, I will turn the microphone over to the President and CEO, Dr. Mitchell Katz, to continue with his remarks.
Thank you, Dr. Marthone, and I'm very proud to be here on behalf of Health and Hospitals. It is an amazing organization filled with phenomenal people, physicians, nurses, social workers, environmental service people who really live our mission and come every day to do the best possible job. And I appreciate so many of them for being here and being part of our meeting. I want to also thank those of you in the audience who came out to tell us your thoughts about Health and Hospitals. We're interested in hearing your feedback. We're interested in ways of making Health and Hospital better. I want to highlight some of the amazing things that happened over the last year. We opened the Ruth Bader Ginsburg Hospital on the campus of South Brooklyn Health, the first hospital to be rebuilt in New York City in a very long time. I see our cab chair here. Nice to see you. And it's a beautiful hospital. Our nurses had a big year. We were able to have them gain pay parity with private hospitals thanks to a NISNA new contract. And I'll point out, because I know and I received feedback from our CIR residents that it didn't happen overnight, the nurse agreement, and there was a lot of opportunity for the nurses to come and talk to the board about their issues, and with good negotiation, it eventually happened, and we are confident that the same is going to happen with our residents. But nothing in the city system is ever straightforward or immediate. We remained at the forefront of the city's response to the historic asylum seeker crisis, providing shelter, health care, casework, and social services to thousands of asylum seekers at our arrival center and the humanitarian centers. Correctional Health opened the first ever Reentry Service Center on Rikers Island. We have a lifestyle medicine program in every borough. Our hospitals are serving plant-based meals as the primary choice for dinner and encouraging our patients to eat the tasty food that promotes better health outcomes. New York City Care, our program for those who cannot afford or are not eligible for health insurance, hit 125,000 members. We housed 500 patients of ours into permanent housing. Newsweek again ranked our Seaview Hospital as the #1 nursing home in the state. That's #1 regardless of public or private. 3 of our other skilled nursing facilities ranked in the top 10, and the 5th was ranked in the top 30. And this is in a state with 600 nursing homes. We successfully advocated for $95 million in city, state, and federal funding for equipment. We have 9 new murals. We have finished converting medical units to psychiatric units after COVID, so that we're now back to 1,000 psychiatric beds. We broke ground at Woodhall for 93 apartments, and I thank Greg Solis for being a major advocate of using our parking lot much better for housing for our patients. We distributed $1 million in debt relief to behavioral health providers. We launched telehealth medication abortion services, becoming the first public system in the nation to do so. We've expanded our surgical services using the Da Vinci robots throughout our system. And our child abuse prevention and treatment team launched a multi-year project for the New York City Administration of Children's Services and Public Policy Lab to improve referral patterns so we can increase the number of hospital patient families who receive community-based services. So some special things that have happened in Brooklyn. We're here thanks to Sheldon and his great staff. We appreciate them hosting us. Kings County opened a behavioral health center extended care unit in March 2023, which has enabled people to stay up to 90 days. We know that one of the problems is that mental health is a chronic problem, and that a 7-day, 14-day hospitalization may not be enough to change the arc of somebody's life. But the new unit enables people the time they need to really achieve recovery. If you haven't seen the We Are Kings mural here, I hope you'll go buy it. It's beautiful, and it was a product of the work of Kings County staff as well as patients and community members. In terms of South Brooklyn, we welcome you coming by and seeing how beautiful the hospital is, seeing the statue of Ruth Bader Ginsburg that stands in the lobby. They celebrated being 1 year free of all catheter-associated urinary tract infections, which is a huge success. The hospital's emergency department was the first in our system to receive the prestigious Emergency Nurses Association Lantern Award for their excellence. They also completed 800 robotic surgeries. At Woodhall launched its lifestyle medicine program in November. The ICU received the Gold Level Beacon Award for nursing excellence. Their bariatric surgery program received accreditation. The hospital was able to renovate its fetal echo services. It was redesignated a baby-friendly hospital. And finally, last fall, the entire community came together to help the hospital when a storm caused a neighborhood power failure. My favorite story of the storm was as one of the last patients left on a stretcher when we closed the hospital, she yelled, "I'll be back," indicating her love for Woodhall. Also, our Gotham sites have seen improvements and upgrades at this COVID-19 Center of Excellence at 1815 Broadway. Patients can now get MRIs, CTs, and X-rays as part of their care. And Cumberland has a brand new 3D mammogram machine. So lots of great things have happened. We want lots of great things to happen in the next year, and we look forward to hearing your suggestions and feedback during today's hearing. So with that, I'm going to turn it over to our Deputy Counsel, Blanche Greenfield, to explain the rules of the road.
Good evening, everybody, and welcome. I am so pleased to be able to share this evening with you tonight. I just want to reiterate that if anybody does need translation services, we have translation services available in Spanish and French Creole, and the number to call would be 212-788-3359. Dr. Katz, thank you for the summary of last year's events. As my card reflects. Yes, 212-788-3359. I'm sorry. I'm sorry, I can't hear you. Okay, this is translation services for this event. This is the number to call if you need translation in either of the two languages that I identified. This public meeting is the third in a series of 5 meetings conducted annually across, one more time, and then somebody else will be able to tell you. It's 212-788-3359. You're welcome. As I was saying, this is the third in a series of 5 meetings conducted annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on the programs and plans of the New York City Health and Hospitals, as well as to afford all of you an opportunity to present oral and/or written testimony concerning New York City Health and Hospitals' performance. Public testimony, both oral and written, will be transcribed and forwarded to all of the members of the Board of Directors for their consideration. Registration to be a speaker, you have 3 more minutes until 6:30 if you want to be a speaker, so it ends at 6:30. I will moderate the balance of tonight's meeting, during which you are all invited to share your comments and concerns about New York City Health and Hospital. At this juncture, I will briefly highlight the format and rules for the testimony. The most important point to understand that the members of the Board of Directors are here. Sir, if you don't mind, we'll give you the number, but we have to proceed with the program. We're here to listen to you and not to engage in a dialogue. This is not a question and answer forum. In order for each registered speaker to have an opportunity to testify, registered speakers are allotted Okay. Each speaker will be given 5 minutes to speak. As you can see at the desk, there is an electronic timer that will provide warnings about the expiration of your time. A yellow light will indicate that the speaker has 2 minutes remaining in their allotted time. A red light will signal that the speaker's time has elapsed, and a flashing red light signifies that the speaker has exceeded their time allotment. Please follow the directions provided. Once it's flashing, I will be asking you to please move on. If you do not complete your comments within the allotted time and you have a written statement that constitutes your full remarks, you may submit your full comments by calling the infamous number 212-788-3359 and making arrangements to submit the full statement into the record. Your written testimony, along with the transcript of your oral presentation, will be shared with the members of the Board of Directors. Please note that you cannot transfer your time to another speaker. You have 5 minutes. Use it wisely. So with that, we will move on to the first speaker, who is Assemblyman Michael Novikov, who's the New York State Assembly District 45. Assemblyman, are you present? Okay, then we will move to our second speaker, David Schaefer, Constituent Liaison, representing New York State Senator Roxanne J. Prasad, District 19. Yes, please, David, would appreciate it.
Hello, everybody. Thank you for allowing me to be here. Senator Roxanne J. Prasad is thrilled to support hospitals. We are very concerned with our constituents' health services as well as mental health. I'll share some highlights that the senator fought for in this budget, which includes an $800 million for distressed and safety net hospitals. We fought for paid prenatal leave and $33 million for mental health first responders. Additionally, there's a capital grant that we secured for American Italian Cancer Foundation for digital mammography equipment. And on that note, we have an event coming up on June 27th for free mammography screening. And that is 100% no cost, copays and deductibles waived for anybody with or without insurance. We're very excited to offer this service right at our office by way of a mobile van, and that's on June 27th. Registration is required by calling our office. I'll share our office number now, which is 718-649-7653. I also wanted to share that tomorrow we're having an e-waste and shredding event for all of anybody who'd like to come and get rid of those materials is welcome to join us at that same location, East 96th and Avenue J. On May 31st, we're doing a menstrual products distribution as well at the same location. So please do join us for any of our free community events. Thank you so much for allowing us to serve you. Have a great day.
Thank you so much. Appreciate that. Our next speaker is Francisca Leopold, Community Advisory Board Chairperson, New York City Health and Hospitals, Kings County. Welcome.
Thank you. Good evening, everyone. In March of 2023, Kings County opened the Extended Care Unit, also known as an inpatient psychosocial rehabilitation program. Admission to an ECU can be an alternative to long-term hospitalization for individuals requiring more intensive inpatient treatment, but who may no longer be appropriate to stay in a short-term acute hospital setting, or who may be repeat admission due to psychosocial factors that impact their presentation. The ECU at Kings County is the second unit of its kind in the H&H system. In August of 2022, Borough President Antonio Reynoso announced a $15.6 million of capital funding to be allocated to the Kings County NICU and Mother-Baby Unit to help close disparities of maternal mortality rates found among people of color compared to their white counterparts. The allocation would convert units into family-friendly space, providing comfort and privacy for parents and newborns. This funding is dedicated to renovating the NICU and Mother-Baby Unit into single occupancy family rooms at the NICU and single occupancy postmortem family rooms within the Mother-Baby Unit. These new developments allowed Kings County to continue providing high-quality, patient-centric care by offering the latest advancement to patients in accommodating environment to encourage positive parent-infant relationship. A survey was conducted in our community, and the percentage of maternal mortality rates was shocking. We thank the Borough President for considering Kings County Hospital. At our legislative breakfast, which was held on March 8th of this year, Council members Rita Joseph, Darlene Milley and Farrell Lewis presented the hospital with $6 million for a LINAC mission. On Friday, May 3rd, Kings County held a centenarian birthday celebration, which celebrated our hospital's super seniors, all ages 90 years and above. Kings County Behavioral Health Department, in partnership with the Community Advisory Board, will be hosting its very first mental health wellness fair on May 21st. From wellness session to storytelling, it will be a day of making connections, insightful conversation, and educational opportunity. This event is open to all. And last but not least, the Kings County Auxiliary held its annual Mother's Day plant sale last Thursday and Friday. They also donated flowers to new mothers in the hospital. I wish to leave with you this quote: "Allow me to always listen to my patients, whether it be in times of joy, pain, or sorrow. Allow me to always provide the best possible care for my patients, considering the whole being and do no harm. Allow me to stay true and compassionate to the service and medicine and not lose sight of that in tough times." Thank you.
Thank you very much. Thank you. Our next speaker is Roseanne DeGennaro, Community Advisory Board Chairperson, New York City Health and Hospitals, South Brooklyn Health.
Thank you.
Welcome.
Okay, thank you so much. Good evening, Dr. Katz and members of New York City Health and Hospitals Board. I am Roseanne DeGennaro. I'm a patient at the hospital and I'm the chair of South Brooklyn Health Community Advisory Board. On behalf of the board, I would like to thank you for giving me the opportunity to speak tonight. I am happy to report that South Brooklyn Health Ruth Bader Ginsburg Hospital is doing fantastic. Under the leadership of our CEO, Svetlana Lipinskaya, Dr. Terrence Brady, our CMO, and our CNO, Majender Kaur, we have progressed further than we could have ever imagined. We had a great year. The highlight, of course, was the opening of our RBG building. The building itself is amazing, and it is staffed with amazing personnel. This can be verified by the numerous awards that we have received. From the American Heart Association, we have received the Gold Plus Award for stroke and Silver Award for NSTEMI. Our emergency department nurses received the Lanton Award from Emergency Nurses Association. We were one of only 3 hospitals in New York City to receive this. South Brooklyn Health also received the Gold Level National Sleep Certificate from Cribs for Kids. Our surgical ICU nurses received the Silver Beacon Award from the American Nurses Credentialing Center Pathway to Excellence. We have also received the Gold Plus Award for blood pressure control from the American Heart Association and the American Medical Association. We are a certified stroke center. We are a PCI center. We have gone, I know you had said this before, but I'm going to repeat it. It's not just a year, it's 450 days without a catheter urinary tract infection. So this all shows how our staff is dedicated. Thank you. Thank you. It shows that our staff is dedicated to an excellent care for our patients. There is a saying, if you build it, they will come. Thanks to the support from New York City Health and Hospitals and our city, state, and federal elected officials, the Ruth Bader Ginsburg Hospital was built and opened last May. So just as the saying goes, they came. With the amount of visits we have seen in our emergency room so far, we expect 98,000 visits by the end of this fiscal year. There has been 1,162 surgeries performed by our Da Vinci robots. Of course, this could not have been accomplished without our highly competent doctors who are certified in robotic surgery controlling that robot. There have been over 1,100 births through April, and we expect 1,400 by the end of the fiscal year. When a baby is born, you hear Brahms' lullaby. That music gives you such a good feeling of hope in a hospital. Just because we have a new RBG building, our older building has not been forgotten. It will become the Wellness Institute with modern outpatient departments. It will offer primary, preventive, and specialty services to adults and children. There will be a new state-of-the-art women's health pavilion where on one floor, women can go for all their medical needs. The first phase has already begun. There is a second phase, which would include modernizing the labor and delivery operating rooms with new equipment, also the mother-baby rooms, and redesign the NICU and create family-friendly spaces. With additional funding, we can take this project to even a higher level. We are excited about the renovating and modernization of a very utilized hematology oncology infusion center to give it a modern and cheerful look, which will match the caring, knowledgeable, dedicated staff who help you get through a very difficult time in your life. Believe me, I know. In 2012, Superstorm Sandy destroyed our IDG Israel Community Center's original building on Neptune Avenue. This health center was and is very important for the residents of the western end of Coney Island. Because of that, H&H in 2015 built a temporary center. We are now looking forward to a permanent site which will be housed in a newly constructed building. This site will include a pediatrics department, which is so needed in our community.
I'm going to need to ask you to please
I'm almost
close
finished.
your
I
remarks.
promise.
Thank you.
Okay.
Appreciate it. Okay.
As you can see, all the funding we have been given has been well spent. I am now asking on behalf of our community for a most needed service, a level 1 trauma center. We are at the most southern area of Brooklyn. We are very highly populated, not only during the summer months, but the entire year. That population is only growing with all the new construction. Yesterday at 4:45 p.m., I checked on how long it would take from my house to the nearest level 1 trauma center. The site said 33 minutes. Can you imagine that when it would only take 10 minutes to get to South Brooklyn Health? It's no brainer because we know that the sooner you arrive at a facility, the better chance you have of surviving. Not only that, but you've taken time that could have been used by the ambulance to respond to another emergency. Please take all this into account and begin the process to give us a chance to survive. Thank you. I'm sorry I was long.
Very much. Thank you. And now you can take a breath. Thank you. Our next speaker is Barbara Williams, Community Advisory Board Chairperson, New York City Health and Hospitals Woodhull. Welcome.
Thank you so much. Can you all hear me?
Yes.
Yes. Great, thank you. Good evening, members of the Board of Directors, Dr. Katz, President and CEO, and all others present at this hearing. My name is Barbara Williams, and I am the Chairperson of Woodhull Community Advisory Board and a lifelong resident of Brooklyn. Thank you for allowing me to share some ideas at this meeting. I would like to acknowledge Mr. Kalist, our CEO, Dr. Lisa Scott McKenzie, Chief Operating Officer, all staff, my fellow CAB members for their dedication and commitment to improving Woodhull and providing excellent health care for the residents of North Brooklyn. The CAB is fully supportive of the CEO's vision of making Woodhull a model hospital and the hospital of choice for North Brooklyn. And we are fully satisfied with the partnership and collaboration with the leadership and staff. In addition to being a CAB member, I also serve as a board member for the Lindsay Park Co-op. This co-op houses at least 2,700 families. I and many of the shareholders are patients of Woodhull Hospital, so it's important that I contribute to the great culture and the wonderful services that are provided. What makes Woodhull Hospital so special is that it doesn't just heal the body, it also heals the community. The employees at all levels understand the true needs of the community and are our true healers, trusted healers. Woodhull has made significant progress with access to primary care and reduced waiting time for a first-time appointment. We need to retrain our providers and recruit new ones in order to further improve access to care. This is very consistent with Dr. Katz's goals. We understand that salary is a big factor, and we ask the Board of Directors to increase salaries as much as possible to make them more competitive with the rest of the industry in order to recruit and retain providers. New York City Health and Hospital Woodhull's Department of Ambulatory Care continues to expand to provide key clinical services that meet the needs of the community. In 2022 and 2023 respectively, Woodhull launched its lifestyle medicine program, SafeNet Practice, and its street health outreach wellness program. This is also known as SHOW. The lifestyle medicine practice provides patients with resources and tools they need to improve their health by making key lifestyle changes. The SafeNet practice provides quality primary care services to those experiencing homelessness. The SHOW program consists of a mobile clinic van, and this provides a basic medical services in street outreach to those experiencing street homelessness. In addition to the above, the adult and pediatric primary care practices provide support to patients throughout the community health work program to address patients and social determinants of health. In addition to primary care expansion, the specialty practices have expanded clinical services to improve access to care. These services include pulmonary practice, the asthma clinic, ophthalmology services, and a hepatitis C clinic, which is embedded in adult primary care. And lastly, the department has recently acquired brand new equipment for several practices, including physical rehab, ophthalmology, dental. This is an effort to continue to provide our patients with the best care as possible. Despite our many efforts, we continue to face challenges to address the changing needs of the community. And at this time, the department is working in collaboration with community partners and agencies to provide support to newly arrived asylum seekers to ensure they are able to access healthcare services. Unfortunately, many specialty services in high demand by our community are either not available at Woodhull, or the waiting times for an appointment are so far into the future that we have to seek care elsewhere. This is obviously not good for residents, the hospital, or even Metro Plus, Health First, and other managed care companies. We understand that all specialty needs, we understand that all specialty services cannot be provided at a community hospital such as Woodhull, but a bigger effort should be made to offer these specialties that are in high demand by the North Brooklyn residents.
I'm going to need to ask you to please close your remarks. Your time is up, but I want to remind you, you can submit your written comments.
Okay, thanks. I'll move forward and say we continue to do all we can to make H&H and the Brooklyn proud of Woodhull. The fact that Woodhull has been leading the way with so many healthcare initiatives and awards in Brooklyn is true reflection of the dedication and hard work of the staff and community. Thank you for your time and thank you for your support, the Board of Directors, H&H leadership, to make Woodhull a continued success, the hospital of choice of North Brooklyn.
Thank you very much. Thank you. Our next speaker is Dina Jabbar, who is a resident here at Kings County Hospital. Welcome.
Good evening. Thank you all for being here, and thank you to the community as well. I'm Dr. Dina Jabbar. I'm a chief resident here at Kings County in the internal medicine department. I've actually been at Kings County for 6 years now. I represent about 2,300 residents on the H&H payroll at 8 hospitals and 150 departments that keeps this hospital, all of these hospitals functioning. The contract between my union CIR and the city expired in December of 2021. It is currently May 2024. Since then, we have continued to show up every single day, work hard. We treat our patients through every wave of COVID, through everything, monkeypox, everything that we've seen. Many of my colleagues, the same people who brought our city through the worst of the pandemic, graduated and never saw the pay raises they deserved. As you know, we are currently in contract negotiations and have not seen this increase in 4 years, while our safety net colleagues are outpacing us in terms of salary. If we accept the city's current offer, by next year, this gap will rise to at least $5,000. This trend is likely to adversely affect the ability of NYC H&H hospitals to attract talented and committed resident physicians. Applying for the match is no simple task. We urge you to join us in calling on Mayor Adams and New York City H&H to settle a fair contract with us that truly supports the city's safety net hospitals and the Black and Brown communities that they serve. That means a contract that provides equitable pay to us and urgent investments into our union's patient care trust fund. For example, this patient care trust fund, which enables us to acquire much needed medical equipment for our hospitals. Last year, we funded $700,000 to hospitals. This was all funded and done through the residents' work. This is all extra work that we do outside of our expectations. It's also critical that the city meets our demands for on-call coverage pool and holiday programs, which ensures our hospitals are staffed enough at all times to cater to the patients. When a resident calls out, the residents step up and help out. While we appreciate the city and H&H's acknowledgement of our position that pay equity with other safety net hospitals is crucial and necessary, their offer at our recent contract negotiations still falls short. Many of us choose to do our residencies in New York City and at H&H because of our dedication to this system's mission of treating everyone who walks through our doors, regardless of their socioeconomic and immigration status. We remain committed to this mission and are eager to settle a contract that helps take care of us as we help take care of everyone else and all of you in here. All we are asking for is the city and H&H to make up the difference and make us and our patients whole. Thank you.
Thank you. Our next speaker is Shane Solger. Did I pronounce it correctly? Resident? Are you a resident here or just resident?
Here, thank you.
Okay.
So first and foremost, thank you for your attention and thank you for allowing us to speak at this forum. My name is Shane Solger, and I know it's spelled like Folgers coffee. Everybody wants to do it that way. And I'm a PGY4 emergency medicine and internal medicine resident here at Kings County. I started my residency in 2020 in the middle of COVID during a time when I was never quite sure if I was going to be the next headline healthy person who died tragedy, as I was surrounded by people in their 20s, 30s, and 40s dying here at Kings County. During the periods of the COVID pandemic, COVID monkeypox epidemic, flu, COVID, RSV, tripledemic, and during a time where our patient censuses are at an all-time high and residents are facing an unprecedented level of violence at work, I still haven't received a pay raise. Instead, we've received nearly a year's worth of being told that the city's appreciation for us and our sacrifice ends at the 3% limit of the bargaining pattern offered to other unions. This is a pattern that assumes a 40-hour work week and a city pension, and anyone who knows residents knows that we get neither of those perks. Our most recent offer from the city was to take the money from the pay raises I was supposed to get over the last 4 years and pay it forward, and use my money to pay for higher salaries of residents who haven't started working here yet. Essentially, their plan is to rob Dr. Peter to pay Dr. Paul. At present, we're set to be the lowest paid safety net hospital residents in the city. And as many of you know, we also do much more work than other residents in other hospital systems. This poor salary worries me. When I graduate, I want the residents who work here to be the ones who wanted to work here and not the ones who are and not the ones who have to work here as a last resort. I want the residents working here to be the ones who are going to work to make this place a better and safer place to deliver care, and not who are going to come here, clock in and clock out. I know that presently our hospitals are filled with residents that are willing to do extra for the sake of our patients. To prove it, we recently filed a grievance with our city for all the tasks that we do that are considered out-of-title work, or work that does not fall within the realm of what a doctor in training should be doing. And over the course of 2 weeks, we logged nearly 1,000 occurrences. Residents fill the holes of our hospital for the transporters, nurses, phlebotomists, patient care technicians, and clerks throughout the health system. And for the sake of facilitating patient care, we're willing to do these tasks. And just as we're willing to do this for our patients, we're hoping that you're willing to support us by pushing the mayor and the powers that be in our city to make sure that we're paid fairly and so that we can continue to attract caring and compassionate doctors to our healthcare system. I appreciate your attention. Thank you so much.
Thank you so much. And we have another resident, Prama Perumal. Welcome.
Thank you, everybody. Good evening. My name is Prama Elia Peramal. I'm a physician. I'm actually a fellow, having completed my internal medicine residency at Woodhull Hospital. I'm now finishing fellowship in pulmonary and critical care medicine at South Brooklyn Hospital. So what I wanted to talk about, I think most of you know that we're engaged with the city in contract negotiations. And what I wanted to do was to express to this group why this is so important to us that we ratify a fair contract and to raise some issues that I believe are within your purview to address as leaderships within HHC. So my fellow CIR members and I have testified 3 times now before the City Council talking about issues on work conditions, well-being, and the city's inability to help us settle a fair contract. Now, in my almost 6 years at HHC, I've rotated across 4 different hospitals. I was here through each wave of COVID. I've seen our patient loads increase, and I've seen our residents and fellows get pushed to something of a breaking point as we struggle to afford basic needs on the HHC pay scale, especially with increasing housing, healthcare, childcare costs, all while being forced to take on the extra burden of some of these excess non-physician, non-educational tasks to fill gaps within our hospital system. These are the results sometimes of shorting staffages or imbalances, but as well as they're also due to a culture of these hospitals of leaning very heavily on house staff in a way that I don't think everybody realizes. As was stated by my colleagues, on May 1st, we filed 26 out-of-title grievances representing almost 500 instances in the previous 2 weeks alone across HHC hospitals, detailing how staff have been activated to engage in duties otherwise covered by social workers, nurses, transporters, phlebotomists, and clerical staff. And Dr. Katz, I was there yesterday with you in the city council chambers, and I know you were under the impression that this was a thing that happened only when individuals would call out, and that the extra burden would get shifted on house staff. Respectfully, that's not the case. I've been here almost 6 years. 4 different hospitals. It is routine. It is embedded in the workflow of our hospitals. And it's something that I think that this group can affect change on, right? We can hire those more people. We can support our house staff. We can enforce a culture that takes that burden off of them. At my time in HHC, and I know you're aware of this, I think we've corresponded on email at least once or twice. We've suffered suicides among house staff. A close colleague of mine at Woodhull attempted suicide and was hospitalized for several days. Other colleagues of mine have gone on mental health leave. Others have had to start antidepressants. This is the breaking point that I'm talking about. The stresses of this job combined with feeling unsupported in our employment environment, financially and otherwise, have led to a lot of talented doctors leaving HHC once we finish our training. I myself was offered to stay on here in the critical care department at Kings County, and I have to be honest, as I'm nearing the end of my training here, taking in the entire breadth of what me and my colleagues have experienced, it's a very difficult. I simply can't get myself to a place right now where I feel good about staying on and working for HHC. To add insult to injury, for a lot of our house staff completing 3-year residency programs, they'll graduate never having received a pay increase at their time here. Yesterday, Dr. Katz himself testified that our hospitals cannot run the way they do without residents, and anybody who knows anybody who's worked with patients in our hospital systems knows that that's true. When hospital leadership fosters a supportive, cooperative relationship with health staff, everyone wins, especially our patients and our communities. You don't need to call the police on us. We instead urge you guys to appropriately pressure your city contacts to hear our HHC house staff's asks and to support us to pass a budget that makes a real investment in us, that demonstrates that you value our contribution to this system. Thank you, guys.
Thank you very much. Next speaker is Violetta Gomez-Uribe, Community Relations Specialist. No? Okay. Our next speaker then would be Mohammed Razvi, Chief Executive Officer, Council of People's Organization. Can you all hear me?
Not really.
Oh, okay. Well, maybe that's why no one's showing up. Okay.
I really
Well,
can't.
I'm going to go back and just try it again then. So it was Violetta Gomez Uribe, Community Relations Specialist. Okay. And our next speaker was Mohammed Razvi, Chief Executive Officer, Council of People's Organization. Asma Mehedi, Chief Operating Officer, Council of People's Organization. Right. Najari Frazier, Behavioral Health Associates. Thank you. I had a bad run over there. Thanks for coming up.
Good evening, everyone.
Evening.
I hear words of homage and gratitude for the many New York City H&H employees. I would like to say thank you. Also, I would like to say thank you to Payroll Shared Services for the effort they apply to ensuring the compensation of thousands of employees. However, we still face issues, and to answer these problems, I understand H&H is working on a new payroll system. Going forward, I hope to see a well-functioning payroll department as well as the efficient software it takes to accurately and timely distribute employees' pay. This payroll system and department should never have an antiquated system that does not meet the needs and demands of a modern-day workforce and environment. There should never be a system or software in place that at times is counterproductive and or illogical. Examples: anytime there's a payroll issue, an employee has to wait until the next paycheck. We shouldn't have to wait to be paid just because the system is in an off cycle. We are in a digital age. Use a system that can issue corrected compensation as a direct deposit immediately. Next, we are compensated for shift and or night differential, but our pay stubs do not show the amount of hours of compensation, nor do they reflect the rate of the shift differential. How do we know we are accurately being paid? There's no transparency. Our pay stubs document two different calculated forms of overtime compensation, one stating just overtime and the other FLSA overtime, Fair Labor Standards Act. The latter yields a higher amount. We need a thorough explanation as to why that type of accounting is in practice and as to why we cannot always receive the higher amount. I had a personal bout of my own after taking an FMLA leave to bond with my newborn child. Now, because I took this leave, my employee status became inactive, which told the system not to pay me my approved overtime. Unacceptable when I'm at home trying to bond with a child and be at peace. It was discovered to be an HR issue for not returning me to an active status after only being on leave for 2 weeks. The system should not have rejected my overtime pay. It took 10 weeks versus 4 weeks for me to finally be paid, that which was mine in the first place. Throughout this time, I felt like I was being robbed by H&H of money and a peace of mind. Also, I've worked at other places and been compensated, and never has there been every year an ATLS mainframe timekeeping year-end process that takes approximately 4 weeks to complete, which delays the compensation of people of that time. Never. I hope you take these things into consideration when you're putting together this new payroll system, because being considered an essential worker during COVID, and even now being one of the working for the city and not even receiving the highest actual pay, I think when we are deserving of our pay, it should be paid on time and be accurate. And if not, as soon, we shouldn't have to wait 2 weeks or the next week and the next week for something to be corrected. Thank you.
Thank you very much. Our next speaker is Deborah Greif, Chairperson, Brooklyn Family Support Services Advisory Council. Welcome.
Thank you. As my name is Deborah Greif, I am the chairperson. That means I chair the committee from OPWDD for parents who have children with developmental disabilities living at home. I let the Office of Persons with Disabilities know what services are needed. I represent Brooklyn in Albany. I am also a patient of Coney Island Hospital, and yes, I've used Kings County. First, I'm going to make my first complaint. I'd appreciate in the future when if you're going to hold a public hearing here, I need to know where the accessible bathrooms are. I had to leave my walker outside the stall. Thank God I was able to hold on to things so I didn't fall. I didn't have that problem at Woodhall. Definitely don't have it at Coney Island Hospital. I don't have that problem in the E building where the dental clinic is. So that needs to be fixed and addressed. Please fix the sidewalk out there. If it wasn't for my son looking down, I would have fallen with this walker and I wouldn't be here. I'd be in the ER. Don't want to go to the ER for something that's not my fault. I also would like to say that I'm very happy with your dental clinic in Kings County for the emergency. Thank God I remembered how to get my son there. We knew to take Access-Rite at 6 in the morning. We got there 6:30. Of course, we were number 12, luckily. But this is the big problem. You now have this dental clinic at Coney Island Hospital. Now, if I need basic or my son needs or children with developmental needs dental care, we have to wait more than 1 year to get basic dental care. All the insurance companies, especially the one you control, MetroPlus, gave me a list of every emergency dentist I could go to. I was on the phone with a day and a half. None of them take emergencies anymore. So I knew I had to do the old routine, get up super early with him, make sure that he was numbed and medicated, on antibiotics, got him to Kings County in time, as I said before. Your staff is great. They understood he was a special needs patient, and they were very glad because we did see 2 patients. We did let go ahead of us. Why? They had serious mouth infections and they needed the care now. But you see, Coney Island has a dental clinic. I would have preferred, if I had my way, I would have taken my son into Coney Island's ER and wanted an oral surgeon right then and there to pull it. Because I don't think it's fair that I have to go to Kings County. There's not putting it down. But you now have a new hospital. You've built up, and I have been advocating for years. Yeah, my son was born in Coney Island Hospital. I have been, you can talk to Dr. Krishna and the others. I go to your rehab. I have a great OT. Dr. Valor runs a great department. But your dental clinic at Coney Island Hospital needs to be improved. It is not accessible, so there's no way when I used my wheelchair or my walker could I get in there safely. You use the old-fashioned x-ray where they put the things in your mouth that hurt. Kings County doesn't have it. Bellevue, I know, doesn't have it because my son almost had to use Bellevue because the NYU dental clinic for special needs across the street almost couldn't take care of him. Thank God Bellevue came through with the emergency blood work and called across and said, either you pull it or there will be a problem. They did defend us. But I should be able to take him to Coney Island Hospital, less than 5 blocks away from where we live, to have them pull his tooth or give him the right dental care, considering he's a diabetic who has serious asthma, like his mom, and his pulmonary doctor is there. I would have been much more comfortable. Thankfully, they coached. I knew what to do because he coached me very well, Dr. Krishnan, as well as Dr. Glatzer, our primary care, who made sure my son was on the correct antibiotics. Now, my son, as a child with developmental disability, is people don't believe it because he didn't scream or cry. He's high functioning. But I have families whose kids cannot handle that. And when we ask for help in the services, we're not given that. I have asked this for more than 30 years. I won't go to the IDG because it takes forever. I'm asking for basic dental care without waiting for a year and a half. I have to take them into the emergency room or I have to take them to Kings County Dental Clinic and overburden the staff who does a fantastic job, but they're overworked. It's not fair. And this is happening in Jacoby, Bellevue, in Elmhurst. I don't know what they do in Staten Island, but I know the parents there cry to me all the time. So please, dental care is a very important part of health too. And if you want kids with developmental disability not to be screaming and acting out, it's because they probably have a tooth infection and needs to come out or be treated differently. So please fix the dental clinics and please have more accessible bathrooms with better labels. Thank you.
Thank you very much.
You're welcome.
And now we have Christopher Greif,
Yes, the son.
who's an advocate for disability, Brooklyn Family Support Services Advisory Council. Welcome, Christopher.
It's easier. Good evening. As I'm Christopher D. Greif, a lot of you guys know me from other titles, but I've been doing this for 30 years, and I've been standing here when we did this at Woodhall. And I'm going to say this as my mother, AKA Deborah Greif, chair of the advisory council said, but I'm also representing the Brooklyn DD Council as well as the former vice chair, but now as the treasurer. We in the disability community need to remember one thing. Yes, we do have mental health, but the word disability, a person's disability can be any kind. A person, you can't even know if a person has a disability, not all shown. As the MTA buses, I know who spoke about it on the bus. But today, as my mother will tell you, if I'm walking from New York Avenue, well, I'm sorry, Clarkson, when there used to be the U building, you have holes on the sidewalks. Needs to be fixed as soon as possible because for safety and for anyone, it is in the hospital's territory. So as I say this before, and I will say this any places, any hospitals, sidewalks must be safe for any person who is a senior or a person with a disability has the right to come in and not do any flying torpedoes up in the air. So I am saying that, yes, it's funny, but it's also sad because I don't want to see someone getting hurt. I've seen that everywhere. My other concern is as a person with a disability, yes, I love Kings County Hospital. Please, everyone, I love coming to HAC Health and Hospitals because we get the help. But waiting a year and a half for a dental, that's absurd. And just so everyone know, it is the 5 boroughs because it's not fair that we have to wait a year. By then, I think I might have to wear false teeth then because how can we keep our teeth healthy? Health insurance is today, everyone's feeling more safer to come to HAC Health and Hospitals. Have to wait a year? No. We really got to work on the dental. And as we're in the 21st century, we, the councils, and I say the word councils with an S in that word, the advisory and DD councils have a lot of information that we work together as one with people with disabilities. That can be all types of disabilities from A to Z. And I left all that information, as Ms. Greif did as well as I do. We've been trying to advocate for many years. As I'm an advocate, and some of you see me as transportation, I'm also a healthcare advocate. I started that first. And I always believe in keeping the HAC Health and Hospitals to the highest levels and keep advocating for the hospitals. It is extremely important, not just to me, but my fellow disability community and the seniors. And let me not forget the veterans who also may have a disability who want to come to the hospital because they feel safe. With the hospital police who are here, thank you guys for being there. And when they come in, they know where they have to go. They get treated respectfully. But how can we come in if we have to wait and wait and wait? And I'm glad our elected official representatives are here because I know they're hearing me going off on this as a song and a dance, which I'm not going to dance, which I'll stick with that outside. But the concern is, as you know, July is Disability Pride Month. We celebrate disability from all types of disabilities. So let's not leave out one type of disability. Every disability is important to us, even important to me, and to make sure everyone gets the health and safely. I understand there are some politicians only worrying about health, but they're also forgetting safety, educating it, to know that how can we help our communities to stay healthy, safe, and have a great time to come in and challenge ourselves. How can we stay more healthy? I thank you, everyone, and happy belated Mother's Day to all the mothers here. Thank you.
Thank you so much. Thank you for your comments and thank you for being an advocate.
Thank you.
Our next speaker is Yahira Elizabeth Peoples Barnell. Here? Okay. Oh. Hold on, I need to adjust my. Is that L-A-L-A? Leah McKee? Did I get your first name correct? Or was it
Yes.
wrong? Oh.
Aaliyah.
I'm on a roll.
Yeah, no worries, no worries. I'm just holding because we have visuals for you.
I'll share with Kalicia, don't worry.
Thank you for inviting me. I'm here today to speak about the Humanitarian Emergency Relief Center that you operate located at 47 Hall Street in Clinton Hill, Brooklyn. For context, last June, H&H leased a block of industrial office space and converted it into a massive congregate shelter where 3,200 single men are now warehoused under your care. The shelter is the largest concentration of new arrivals anywhere in the city, and its size is disastrous. See photos 1 and 2. Tonight, I am representing over 1,000 community members who attended a town hall last Monday. See photo 3. I'll first share our request and then provide more background. We are asking for your leadership to advocate with the city to close 47 Hall and create smaller, more humanitarian shelters across the 5 boroughs. We know the mayor will ultimately decide, but as the operator, you have the leverage and a voice of compassion, and we urge you to use it. Your current lease expires next March, but there is a clause in the contract for a 7-year extension. We must start planning alternatives now so we can stop the extension. I want to stress that this is not about the asylum seekers. It's about the shelter size. I'm a daughter of a Cuban refugee, and my heart breaks for those seeking a better life who find themselves trapped in what many have told us feels like a prison. You and your staff are doing heroic work in a very challenging environment, and we thank you. You are helping the city live up to our values as a sanctuary. But mass warehousing people in distress is not a sustainable solution. The city is moving from the emergency phase, just getting people beds, to the implementation phase of creating humanitarian long-term solutions. Concentrating thousands of rightfully traumatized men in rows upon rows of cots with nothing to do because they don't have work permits, not enough food, and no private space is a disaster. See photos 4 through 7. Living next door to 47 Hall Street gives me a special view. Let's start with the residents. Enrique from Venezuela told me it's a prison. Es como un cárcel. Zero privacy, not even lockers for valuables. Everyone is afraid of theft, and there are racial tensions erupting. Amadou from Senegal told me the security guards won't break up fights between Latinos and Africans. He says he's witnessed 3 stabbings. The men are also hungry. The contract meal deliveries are mostly cold and prepackaged, and most importantly, not enough. Neighbors from mutual aid bring regular meals to supplement what's provided at the complex, and the local mosque has been swamped serving thousands of additional meals. Additionally, there are no common areas. This is true inside and outside. The facility has courtyards, which the developer once promised as socializing spaces, see photos 8 through 11, but instead have been fenced off to shelter residents. So they have 2 options: spend the day huddled on a cot inside, or spend the day outside, which is what most people do. Picture 3,200 men unable to work, seeking refuge in the community, in children's parks, storefront sidewalks, and residential front stoops. See photos 12 through 15. Which brings me to the impact on the neighborhood. With 3,200 people, the loitering and panhandling is at a fever pitch along Myrtle Avenue. The ED of the local bid has surveyed her owners and anticipates what she calls a mass exodus of business. Shelter residents rely on scooters for transportation, but thousands of scooters on sidewalks is just dangerous. Sanitation and parks are swamped. Lastly, my neighbors, there are quality of life issues for sure, but there are seniors on our block who won't go outside. Folks are having trouble renting apartments that subsidize mortgages. We are never going to solve the issues. Indeed, they will get worse with a shelter of this size. It's not about the asylum seekers, it's about the size. You will hear from my partner, Tim, next about alternatives to mass warehousing. He's speaking in 2 turns, I think. We are asking for your leadership to advocate with the city to close 47 Hall and create smaller, more humanitarian shelters across the 5 boroughs. Thank you.
Thank you for your comments. Our next speaker is Jerome Green, Supervisor Community Health. Brown? Okay, the next speaker then will be Rukia Charles Thompson. How about Timothy Walker? Welcome, Timothy.
Did you say Timmy?
I didn't say Timmy, no. I
Oh.
said Timothy. That's for the next meeting.
That's great. Thank you. Thank you for this opportunity. I'm here like my partner to talk about 47 Hall Street. Before that, I would like to start with a big thank you. I would like to thank you for leading the city's welcoming efforts. It is a monumental task, and the Hercs and the Arrival Center that you set up and operate, well and perfect, are a triumph of care. You've helped so many people in crisis find safety, and you've helped the city remain a sanctuary open to the world. My family has had to migrate to new countries for the last 3 generations. I'm the first to get to choose wholly freely where to be. And I choose New York, like so many others, because of its welcomeness. Thank you. Now, as the city stabilizes its response to a heightened rate of immigration, the questions become about the future. My partner Aaliyah spoke about the practice of mass warehousing new arrivals. Will this be our future? She spoke about the need for such facilities at the outset of emergencies, but as an ongoing solution, the tragic realities inside and outside of 47 Hall. Will this be our new normal? I hope not, but I fear it will. There is a clause in the lease for a 7-year extension starting in March. Without your leadership, without you taking a stand and using your unique voice and leverage with the city, the lease will be extended. This will literally cement the practice of mass warehousing into how the city cares for its most vulnerable, new arrivals and otherwise. There are alternatives. Muzzy Rosenblatt runs the Bowery Residents Committee, one of the city's most effective and long-standing homelessness organizations. He says homeless shelters max out at 400 people. All the issues could solve with shelters of this size. Indeed, before 2 years ago, local laws barred the Department of Homeless Services from building new dormitory-style shelters with more than 200 beds because they're unsafe. And it's impossible to manage them without turning them into prisons. So the vision is simple: more right-sized shelters spread more evenly across the borough. At a smaller size, the city can provide safe and humane conditions for migrants and the neighbors who want to welcome them. Can we close 47 Hall? Yes. Will it be easy? No. Imagine this summer scouting new sites. In the fall, choosing sites, negotiating leases, and preparing them for readiness. In the new year, an orderly transition of guests. And finally, in March, before the lease expires, handing those keys back to the developer RXR. This is absolutely possible. The real challenge is actually, before all that, getting the city on board. The Hercs agreement state that H&H is responsible for managing the Hercs at the locations as determined by the city. So it is their call. We know. We're asking you to advocate with them, your counterparts at the Office of Asylum Seeker Operations, DCAS, the deputy mayor, the mayor. You're the ones on the ground. You are the ones shouldering the work. You are the ones with your names and reputations on the facility. This is your leverage. You have the relationships and more, and I promise you, if it is not you, it will not happen. Finally, for the number crunchers, this is a unique case for closing 47 Hall. Not only is it the largest concentration in the city and in the middle of a residential area, it is also massively expensive. It's not a tent. This is an 18-month lease for $45 million, $2.5 million a month, just for the building. I imagine there's some discord growing within H&H about operating 47 Hall and the congregate tent facilities. As the atmosphere from the city becomes more adversarial, I imagine you question if it's a fit with your mission for healthcare excellence. My plea to you is this: please don't cut and run. Please don't allow the mass warehousing facility to be your legacy. Dr. Ted Long said in an interview last year, I spent a lot of time on the ground listening to the types of needs asylum seekers had. I would view the Hercs as places we built brick by listening. So I'm asking you to listen again. I'm asking you to please to listen to this moment. We need to shift before our emergency strategy becomes our permanent strategy. Please don't give up. The call is loud and clear. Close 47 Hall. Thank you.
Thank you very much. And I appreciate your looking at the
I was-
timer, so I saw it. Thank you so much. And you get an extra one for that. Our next speaker is Kent Mark. Welcome.
Thank you. Thank you for the opportunity of being here this evening. Good evening. The name again is Kent Mark. I'm a patient at Bellevue primarily, but also at a couple of other facilities at certain times. And I'm also a former cab member from Bellevue. I think this is a good experience coming here because we get to hear some of the problems that are faced by the employees and the staff. And sometimes as patients, we wonder why things aren't getting done right. I talked about that when I spoke at Bellevue last month. I want to talk about a little more about that tonight, but I also want to let you know at the same time that I am thankful for the public hospital system. I compliment you on the plant-based diet. I participated as a patient in that program at Bellevue when it was available, when it first became available. And I also want to thank the residents who were speaking here and who were apparently overworked or without a contract, and some of the employees that have their own problems, because there's a lot of good people in this system. It's just that I think that things could be better. So I like to give something back through advocacy. And I would prefer that my comments tonight, because I think we can not only talk about what's good, we also have to talk about what's wrong. And so I'd like you to take my comments tonight in a constructive manner. And at the same time, I realize it's a challenging environment. So my comments tonight are not meant to be critical of the medical services that are delivered, but it's more critical of the administration. And again, what doesn't work and how the administration, I think in many ways, and I'll use Bellevue as a primary example, does not get the job done as efficiently as it could be done. Now, I've been told by some people recently that I need to take my complaints or my comments and criticisms much higher because the people at Bellevue and the people at Metropolitan, Gouverneur, et cetera, are not going to be able to change it because the orders come from down on high. So I'd like people to think about that, because when they tell me they want to correct my programs at Bellevue and they give me somebody on the mezzanine floor to deal with rather than dealing with patient advocacy who tells me, listen, we're not really interested in any comments from you about how to fix things. You just tell us what's wrong and we'll fix it. You know, I've been talking to these people for 15 years and I still don't see things fixed. We keep going over the same issues over and over again. And I would use the mask issue as one thing where I was actually told by a doctor at Bellevue, if you don't do what we tell you and wear a mask, and I have a number of comments on that from a legal perspective also on that mask issue, then we're not going to give you any services and we're going to throw you off the property because this is private property. Now, first of all, those comments are totally uncalled for. If they feel that challenged by me, then maybe they ought to go back and look at their job description, and maybe they ought to go back and look how they've been trained and how they talk to people, because I'm sure they wouldn't tolerate that kind of conduct at NYU or Columbia Presbyterian or Mount Sinai, et cetera. There's a way to talk to people and a way to deal with people and get educated as to what it is. What about people with breathing problems? What about people who understand the law and understand that the CDC put out an interpretive regulation which had no public hearings and no public comment and cannot be applied to the general public? Yet people think they can announce this, put up all kinds of signs, and you're either going to comply or they can threaten you with no service. That is not going to work with me, and that's not going to work with a certain other number of other patients that I know. So we really need to re-look and rethink about how we talk to people and how we deal with people. Now, I was also, a comment was made to me by an employee that we don't have to be worried about being outside our job description for what we say to you or do to you because we're self-insured, and we would have to be really do something that was willful in order to be sued in our personal capacity. Now, why would somebody even want to tell me this? You know, I mean, do they know they're doing something wrong, but they think they're covered and it's okay to do this? I mean, I just don't understand why somebody would answer me in that manner. So I often ask, going back to talking to people at a higher level, I wonder sometimes whether I'm talking to people on the mezzanine or whether I'm talking to patient advocacy. Why am I having conversations with these people? Because they don't seem to be able to have an intelligent conversation with me. They're certainly not speaking on my level. They don't understand anything about the law. They don't understand about interpretive regulations, yet they're going to quote the law to me and tell me what they're going to do to me if I don't do what they say that I have to do. And this is just totally ridiculous. It's a very poor way to run an organization, totally unacceptable. So I would use this quote, and I don't know who to attribute to, but there's a lot of ideology within this system. When ideology replaces meritocracy and provides immunity from the consequences of illegal conduct, systemic mediocrity follows. And I think that's what we have. Now, I'm not labeling all people as bad. I realize this is a system with hierarchy. I realize there's a lot of problems, okay, that need to be covered, but things can be achieved, and I think that we can really do better. I spoke to council before about, dealing with American nationals in an appropriate manner, understanding what they're all about. But, I don't want to hear comments from people about, we don't need your thoughts about how to fix anything, because then maybe you don't need any of my thoughts, because if you're really paid in the administration to run the hospital, then you should be running it correctly and treating me correctly and all the rest of the patients correctly without me saying anything or bringing any information to you. So I started on a high note.
Yes, I told you to close on a high note. Go ahead.
Right. I started on a high note, and we're going to leave this on a high note, or at least I hope that you conclude that this is on a high note. So I think we need to talk to the community. We need to consult with the patients and hear what they're saying, not just talk to PFAC or the cab groups where, being on a cab, I know what went on in the cab and how it was moderated, how people could say certain things, not say certain things. Let's talk to the people that experience and receive the services in the system. And let's not have meetings and reports trump the value of talking to the patient and expressing oneself back and forth with the patient. So I can see this system being much better, and I can envision something much better if people would put a little effort into it and change the culture. And that's what I would like to see happen with H&H. And I came here and traveled the distance to come here because I want to convey these thoughts. And if that's what it takes to give something back, that's what I'm going to do.
Thank you so much. I appreciate it. And on that note, that is our last
Thank you.
speaker. Thank you. I want to thank all of you for taking the time and sharing your comments with us. It truly is appreciated because we are your hospital system. It's all about all of you. So thank you very much for coming this evening.
Hi, reporter here. Are we off the record? Yes? Okay. I am not going to leave, though. Co-reporter's going to leave.